So with no further ado, I'll proceed with the presentation. We will talk a little bit today about medications and things that you might want to consider about medications in relationship with your brain health and health in general. I will make this disclosure early. I will not tell you do this or do that, because in my world, things are not like ever in black and white. So if you ask me something, I will say, it depends. And it really depends on who you are as an individual, what your needs are, what your expectations are, and what might work for you might not work for the person next to you. So it really is my talk will emphasize the need for individualized care, really reflective of that individual person, as opposed to making broad statements and making something that you will take home and say, this is what I'm going to do. So there will be some recommendations, general ones, but if you want more specifics, that will need to be individualized, okay? So it's all about, we are all aging, and it's all about healthy aging. What do we want from our life moving forward? Obviously, everybody wants to be in good health and have a happy life. We all want good quality of life, and that definition might vary from person to person. I'm sure you all agree with me that that will include a good physical health, right? Being able to move around, spend time with friends and family, maintain independence, not having pain, obviously. Living without pain is an important part of a healthy aging, healthy living, and good mental health. And the fact that you are all here as a group and trying to sit at tables with your friends tells me that you are doing something really well towards this mental health and good aging, right? Keeping a social network has been shown by several studies to really help with this healthy aging. So what can influence, and what are the things, like general things that can help with healthy aging? Physical activity. I'm sure you all have heard, it's well known that you have to be exercising, be physically active. Today is a nice day, so I hope you get the chance to go out and at least take a walk, enjoy some of the sunshine. It will get, I think, cold on Wednesday, so all these nice days we should take advantage of. Memory exercises, if you read, if you do puzzles, crosswords, those keep your brain working, and that's good. Keep your brain busy, and that's shown to help. Social engagement, I already mentioned. I saw they served some salad, so that's good. Healthy eating, eating a lot of fruits, vegetables, that Mediterranean diet that's high on fish and low in the bad carbs and all of that. So those would be, in general terms, things for you to consider. And I know sometimes it's hard to make changes, but it's worth trying. Now on the things that we need to improve upon, kind of the opposite. We know that even it's the flu season, right? And I hope everybody got their flu shot to avoid illness, and this time it's really circulating around. Social isolation, so we all have our days where we don't really want to be social, and that's okay. I mean, everybody has those days, but trying to get ourselves out of that and keeping engaged with family, with friends, that should be, and living in a community for sure would help. Depression is an important thing. Depression can affect anyone. And a lot of people have the fear of, or they are ashamed to even admit, And we know that if we treat depression, that can actually help. So there is no shame of going through a condition that's outside of your power. What's in your power is to actually go and get help for something like that. And I should have mentioned, if anybody has questions, as I move on with my presentation, I would like to make this interactive, so feel free to raise your hand and stop me and ask questions. We'll also have time at the end, for sure, but don't wait until the end if you have a question. And back to the diet and how that important is, vitamin deficiency can also cause problems, and you might not even know. It won't hurt necessarily. So it's good to go and check with your doctor on a regular basis to have that checkup to make sure everything is balanced. And it doesn't necessarily mean that they will prescribe a medication. Maybe you just need to uptake more fruits and vegetables, and that's the best way to get your vitamins. And I will caution from now, with all those supplements and vitamins that are marketed and you can go and find and buy over the counter, I would not just go and buy those. Okay, and I'll talk more about that. And back to what my background is and my interest, one thing that's overlooked several times with regard to health and brain health are medications. Things that were prescribed or we can buy over the counter in the pharmacy, even in the grocery store, that instead of making us healthier, can actually cause more problems. So those are, sometimes you start taking the medications at a younger age, 40, by show of hands. Is there, who is taking at least one prescription medication? Okay, I said at least one. I'm sure if we say more, I'm sure many of you are raising your hand with taking more. I started in my 30s, right? And I know that at some point, I'll have to have those reevaluated. Even if I'm taking something for a long time and I've been doing fine, there are times where I need to go and check back and see, is this still what I need? Is this still helping me? Or maybe I added other medications, and now they kind of interact with one another, and things aren't what are supposed to be. So medications in older adults are sometimes forgotten, and they are not, people don't pay enough attention to what problems they can cause. And this is another big word. I won't ask you to remember it, but there are a lot of medications on the market, either prescription-based or over-the-counter, that have this effect on your nervous system. It's part of the nervous system. We call it anticholinergic effect that they have. And they are found in very common medications. If you go and pick something from the pharmacy counter at any pharmacy or grocery store, cold medications, sleep products, they are likely to include an ingredient that causes these anticholinergic effects. And why are we so worried about these anticholinergic effects? Well, sleepiness, feeling a little drowsy, having your mouth dry, and just not feeling yourself, those are sometimes signs of anticholinergic effects. And the problem is, if you take more than one medication with these effects, they add up. And the chance of experiencing a side effect as a result are higher. So if you kind of feel dizzy and you have blurry vision, chances are you might trip, fall, break a hip or something. So there are really serious consequences that can result from the use. It's something that you can go and buy at the pharmacy without needing a prescription. And again, I don't want you to remember these words. I won't remember and be able to tell them like by heart. However, before you go and buy something new or before you go and fill a prescription, make sure you either ask the doctor or you go and ask the pharmacist. How many of you have a close relationship with a pharmacist? That's wonderful. I love to see that. Pharmacists are wonderful, and they are readily available in the community. You don't need to wait weeks or months to get an appointment, as you would likely need if you want to see a physician, a specialist. And they can answer these questions. They can tell you if the medications you are about to start on is something that might cause more problems than solve. So definitely think about these before getting something new. Okay, why? And I said sometimes medications that we are taking for a long time need reevaluation. Because with age, our bodies change. Like it or not, our bodies change. Our kidney, our liver, these are the organs that help with clearing the medications out of our body. Their function slows down as we age. So then there is a tendency of medications accumulated in our bodies, so taking longer time to clear out. And this gives them more time to actually have an effect on our body. Now, the brain is protected from a lot of bad substances, including like medications that shouldn't reach our brain, but what we call the blood-brain barrier. So that's a barrier between our body and the brain that keeps protection. As we age, that barrier becomes more easily accessible by medication. So they can reach to the brain, they can bind to the receptors in the brain and cause problems like blurred vision, dizziness. So that's more accentuated in older people. So, and the brain is more sensitive to these actions as we age as well. So all of these increase our risk of getting the bad effects from medications. And here's another thing that I wanted to bring your attention to, is what we call the prescription cascade. So what does that mean? It means that a physician or a professional prescribes a medication to treat, obviously, an illness. You go and see the doctor, you have some complaints, and they will prescribe a medication. That medication might cause a side effect, and you might not realize that is caused by the medication. So you go to see your doctor or another doctor, and they don't realize that that's in relationship with you starting a medication. So they want to treat the symptom you address them for. So they prescribe yet another medication. So that's another one. And you can see this going on. And it happens more often than we would like to. And it is like a vicious circle. At one point, you have no idea where it all started. And you end up with, instead of just one medications, you end up with 5 or 6. And they might interact with one another. And it can become really messy. And I'll give you an example. how many of you have joint pain? Right? So you might go and take, I don't know, aspirin or Advil, something to treat that. We call those non-steroidal anti-inflammatory drugs. But they can cause water to stay in your body, water retention that can, and salt and all of that, that can get your blood pressure up. So you could get those painkillers over the counter, right? You go to the doctor. What's one of the first things they do? They measure your blood pressure, right? So your blood pressure might be high because of the effects of the previous medication you started, but they won't necessarily know that. So if they see you with blood pressure, it's very likely that you will leave the doctor's office with a prescription. Sounds familiar? Okay. So one of the first ones they would prescribe is what we call the calcium channel blocker. So that's one of the many antihypertensive medications. That medication can get your ankles to swallow, so they get big, it's kind of like uncomfortable, and you might go back to your doctor and they will be like, well, you have water retention, so you probably need to, we probably need to get rid of that water, we'll just prescribe a diuretic. Okay. Yeah. Yes, and I'm not saying that they are not doing their job. It might be their time constraints. They don't have the time to actually spend it to look at your medications and really assess all of those. I mean, I don't know the situation, but you have the right to ask these questions. And I know sometimes it's overwhelming. It is for me, and I think I'm quite well trained, but when I go and see my doctor and I know she doesn't have too much time for me, I forget what I wanted to ask and all of that. So I usually write down the important things before I even head there, and you should make it an exercise to ask your doctors about the medications you are taking and whether all of them are. Okay, yes. Okay, so the question was about going to the doctor and the doctor seeing all the medication list and whether or not it's their job to look at that medication list and make sure they are all supposed to be there. So again, they might not have the time. I know, and I'm sure for them it's hard to know that, and I know the pressure comes sometimes from the billing administration, and it's not that they don't want to, and I'm sure that, and I know there are a lot of physicians that are unhappy with how the whole system functions. But again, you are your own advocates, and if you have a hard time, yes. Yes, and then you should, when you go inside the doctor's office, you should always ask them if they think all you are taking is appropriate. Now, there is the other side of the story. Not all of the medications you have on your list are prescribed by the same physician. That's true. Right? So I think there is also a little bit of that, not wanting to step on one of your colleagues' feet, right? I mean, there is that as well. That's why you as patients, and there are patient advocates that can help you with bringing this up. And I know it can be complicated to navigate, but the pharmacist can look at the medication and say, okay, I would be happy to contact your physician on your behalf and talk to them. That's one way to look at it. Or you can have them kind of flag things to ask the doctor about. So that's another way to look and make sure you are only taking what you need. Yes? The question was if I consider vitamins as drugs. And not necessarily drugs, but they are definitely something to look at. So it's not just prescription medications. When you put together your list should include prescription medications, vitamins, and supplements. And I will really emphasize the vitamins and the supplements because some of them are being advertised as the miracle drugs, and they are not. And the other thing is they don't go into the same scrutiny with the FDA as the medications. They don't have to show that they work. So these are all like for-profit companies that are selling sometimes, I don't know, water and claim that is like, I mean, I've heard like I think in California they actually sell water, and it's quite expensive because it's from natural springs or whatever, and there is no quality control over there. So it's likely that you might get some illness after drinking, but it's the same idea. So you have to be careful with those, and definitely I would consider them on the list and make sure you address those as well. Okay? So back to this example. You get to the diuretic because obviously you need to get rid of that extra water in your body. But those can induce some imbalances with the minerals in your body, and that can cause something that resembles gout. So if you have a condition that looks like it's gout, they go to see maybe another doctor because they will be a specialist that treats something like that, and they will prescribe yet another medication to treat your gout symptoms. And that one is likely to lower your blood pressure. Now you started with high blood pressure, now it's going down. And when you have hypotension or low blood pressure, you get easily dizzy and you can fall and break your hip. So again, this is an extreme example, but one that might be easier to remember on how this can happen. And the vicious circle, once it starts, it can be difficult to break. Okay, so another term that I'll throw there is polypharmacy. That means basically taking multiple medications. And sometimes they are necessary, but again, sometimes there are too many. And just taking too many medication is increasing anybody's risk for what we call adverse drug reactions. And again, back to your question, it includes not only prescription, but over-the-counter vitamins and some supplements. And when you take too many medications, there is a higher chance that at least one of them is inappropriate. So there are all sorts of lists. I will not go into details where we call those medications potentially inappropriate. And I will emphasize again back to my initial statement at the beginning of this presentation, it's potentially inappropriate. So it might be perfectly fine and the best choice for me, but it might not work, it might be inappropriate for somebody else. So that's something to think about. And it's not uncommon. About 25% of the overall population is experiencing polypharmacy. And you can imagine that the older we get and the older the population we look into, this number is even higher. And that's an estimate from 2012 where they assessed that about 40% of the adults 65 years and older were experiencing polypharmacy. And that was a 70% increase from 1999. That's quite telling. And I'm sure it's going even more. I mean, social media, television, all the advertisements. It still baffles me, all this direct-to-consumer advertisement. So I don't know if you notice, my accent probably doesn't sound like Eastern Kentucky or anything nearby. I'm from Romania, and I moved to the US in 2007, and I was shocked to see, we didn't have that in Romania. I was shocked to see on TV all the advertisements for medication, and what really shocked me the most was when they were presenting the side effects. Yes. It sounded like a fairy tale. It's like you might actually want to experience those, because they were like presented in such a pleasant voice and with really nice background, and all the actors were happy. So I was like, that's not right. And I still think it's not right. But we are bombarded, and they all tell you to go talk to your doctor about getting that specific medication, right? And that's causing a lot of our problems. So what can you do? I already mentioned, you can talk to your doctor, and you can talk to a pharmacist, and they can do what we call medication therapy management. So that's really looking at all of the medications you are taking, including prescription, over-the-counter, supplements, and vitamins, and making sure, and also looking at the health conditions you have, and trying to make sense of all of it, and making sure that what you are taking is indeed the best alternative given your health problems and the medications that you need to take without interacting with one another and causing problems. So it's a complete review of all the medications. So that's actually covered by insurance. So you should be able to get a medication therapy management through a pharmacist, and should be covered by most insurance companies or plans. And so based on this, the action could be what we call de-prescribing. So we are not prescribing, now we are de-prescribing. So the medications that are thought to be unnecessary or even potentially harmful, they can be stopped. And when I make changes, might mean a change in dose. Something that was needed at a younger age might be too much because of all of the changes I mentioned earlier. The medication tends to stay longer in your body because your kidney and liver slow down in their function, so you might need a lower dose. You might need to look into an alternative that will not interact with other medications you might take. So that's something to talk to your doctor or your pharmacist, would be de-prescribing, seeing whether you can get rid of some of the medications you are currently taking. And again, this is what I want to really emphasize, and the message that you should take with you is the fact that patients, your needs, your values, your expectations should be at the center. And you should also be a partner in this decision making. I know sometimes it's hard, but you have the right to be there. I have it as a triangle. We just simplified a pharmacist and the physician, and the patient needs are in the center. So try to, if not advocate for yourself, find someone that can help advocate for yourself when it comes to medications. Okay, and I also wanted to take a few minutes at the end to introduce what we are currently working on. It's a study that's called, we call it in short, INCREASE. It has a long, long name. I might stumble upon it, so I won't say it. I won't even attempt now, but I can. We have the information here. So the INCREASE study, we are looking to see whether improving the medications people are taking and really addressing inappropriate medications. So it's that individualized look at the whole list, delays problems with memory and thinking. So that's our focus. It's the brain health and making sure we understand whether making these changes helps with the brain health. So the study involves several visits over a 1-year period. It involves a brain imaging scan at the beginning of the study. It involves memory tests and surveys. Again, it's throughout 1 year. In total, 7 visits. It's already written there. So this is kind of like a snapshot, a timeline of the study. We start with a screening. So we want people that are over 65 and don't show sign of dementia. They will have this scan to help us understand what's happening and what might help in the future. And then we have cognitive testing at the baseline, at the beginning of the study. We do several follow-ups. Some of them are over the phone. So Brooke is actually the one calling our participants. And some of them would be in person at Sanders Brown Clinic. And then at the end of the study, we are doing cognitive tests again, and that helps us to understand how our intervention on inappropriate medications is making an impact on thinking and memory. So if you are interested to enroll and participate, you really get that holistic look at the medications that you are taking, at the health issues you might experience. You will be monitored by experts at Sanders Brown Center on Aging. That's their specialization. They have a lot of experience in working with older adults and seeing screenings and memory tests and all of those. There is no cost to participate. And again, when I talk to my students and I tell them that I really value their feedback at the end of the class because that helps me with planning for the future, they sometimes look at me and like, yeah, but it doesn't help me. But there are some that are really thrilled to help. So you would definitely help us understand how can we go and advocate more so that physicians really take the time to spend with their patients, because it really helps. And the insurance company should buy into this, because obviously it's easier to prevent. Once you get into that vicious circle, then their costs go high. And for me, it's kind of like a no-brainer. They should understand that, and they don't seem to. So I think if we can show and talk about how much they will save, that might call their attention. So you could help us do so. And this is, in brief, our eligibility criteria, and Brooke can tell you more about the study. So 65 years old or older, taking certain medications, and she has a list that she can screen from, and not experiencing obvious memory and thinking problems to begin with, because we need to make sure we are on the prevention side. And back to what is behind our beliefs and how we structure our study, we indeed have this team. We have a pharmacist, we have clinicians from Sanders Brown, and we have the participant. And everybody is an equal player in the decision making. So we are not forcing any change into our participants. It's their choice to make the change if they believe that that's to their benefit. So it is really around the patient's needs, values, and their expectations. So this is what our study is all about, and really trying to get some more evidence to show that this is a model that should be followed. And with this, well, thank you all, and I would be happy to take any questions you might have. Yes. So the question was whether multivitamins should also be considered as a problem. Again, it really depends on what exactly is included there and what else you are taking. So I would highly recommend that you have someone look and make sure that you are taking what's necessary and not conflicting with your other medications. So again, it really so the question was, if you have 5 or 6 medications, should you take them all at once or should you space them out? It really depends on what those medications are and how they were prescribed. And I know, so there are like pill organizers. So once you go and you know that this is supposed to be taken in the morning, some of them you have to take them before you eat. Some you have to take after you eat. Some of them you have to take right before going to bed. Some you have to take like mid-afternoon. So I think what you need, and again, if you take your list and you have all of that, the pharmacist can help you sort them out. And then there are pill organizers that you can buy, and depending on how many times a day you would have to take the medications, you can get pill organizers where you can have sort them out, and that would be easier than to make sure you took them if you have them in that organizer, and also keep track of the times you have to take them. So I would highly encourage you to consider some sort of an aid to help with keeping things as they are supposed to. And I said I'll come back to you. Well, so there was a recent study that just came up. So the question was about the baby aspirin that doctors recommend. So the most recent evidence is that it doesn't really help, but I would go again. And that might be something that was shown at the population level, so a group of individuals. So I would have a conversation with the doctor that prescribed it to really put things in balance and see it might still benefit you. I would not say go ahead and stop it. I would say go and talk to your doctor that prescribed it and make sure it's something that you want to continue on. So the question is about Tylenol PM being an issue because, in short, because it contains a medication that's an anticholinergic and can really cause, and there are studies that show that anticholinergic medications negatively impact cognition. So it will have an effect on memory, and especially if you are taking it over a long period of time. So back to Tylenol PM, the doctor said it's good for sleep. I'm sure it helps with sleeping because that's one of the effects that anticholinergics might have. And it's true that not having good sleep, it's also problematic. So it might be one of those situations where putting things in balance, so what are the pluses and the minuses of one versus the other, but I will try to see if there is a another option, another alternative that will not bring you that add-on anticholinergic. So the question is about whether there is a guide on what and how many vitamins and minerals to. I don't think there is a guide that would be like universal. So I think in terms of vitamins and minerals, it really is about looking at what you need and if there are deficiencies. Like a lot of people have vitamin D deficiency, especially during the cold season, because we are just not going out and we don't get sun exposure. So then you might get a prescription for a vitamin D. But that just going and saying, get a multivitamin, whatever, that might not be the best approach. So I would see if you need something, I'm always pro like getting those from fruits and vegetables rather than from a pill. I don't like pills. Yes. Mm-hmm. So the question was about the impact that surgery and anesthesia can have. I mean, that obviously can have an effect. I'm not sure what to say in terms.
Have you all ever done any research?
I did not personally. I did not. But I'm sure there is some out there. And I'm not sure, I mean, depending also on what medications they gave you in anesthesia, and which one would be to blame. So that would be something, you know, if we could find out which one, that might be easier to go back and, you know, see which one might be more likely to have an effect like this. So the question is whether in the cold season we can replace the sunshine with one of those UV lamps, right? And what I know, there had been some, I don't know about vitamin D. I don't know about that, but I know that there had been research looking at depression and whether using those lamps help people that tend to have that depression that's caused by, I mean, the blue moods of not seeing the sunshine and the short days, and there were some positives, but I'm not sure if vitamin D, although it's UV, so it might help, but I don't know how much it's too much, and with UV exposure, you want to make sure it's not causing other problems, right? Which is the same with the sun, right? Did you have a question? So the question was, if you are supposed to take your medication every day and one day you forget, the next day when you realize you forgot the one from the day before, should you take both days or you should just go? I would say just go. You don't want to double the dose. I would say, okay, I need to figure out a way for me to not forget, figure out how to keep track of what I'm supposed to take, and the medication organizer might help. So she was giving me additional information on the type of medication, and again, there might be something, if you double your vitamin, that might not cause an immediate problem, but if you double your blood pressure medication, that can be really bad, because you might lower your blood pressure too low that it makes you so dizzy and unable to function, that I don't think you want that. So there might be some situations where it's okay to double, but likely you don't want to double on any of the prescription medications. Okay. Any more questions? Well, thank you so much for your time and attention.